Hi guys and welcome to Tiny Evils. Now we are going to start with another type of systemic mycosis, that is coccidioidomycosis. Now this coccidioidomycosis is also known as desert rheumatism, valley fever or California fever. So this California fever name it will help you remember the epidemiology also, that it is found in California, some part of California, right? So this is caused mainly by a thermally dimorphic fungi that we have mentioned, Coccidioides immitis, right? And this Coccidioid immitis is actually the odd one out of the thermally dimorphic fungi that we've been talking about. And why is that? Actually, like we have been saying that normally at 37 degrees Celsius, these thermally dimorphic fungi are going to exist in the yeast form. But this Coccidioid immitis is not going to exist in a yeast form. It is going to exist in a endosporulating spherule. And we are going to see in just a bit what is an endosporulating spherule. Right, so let's talk about the pathogenesis, right? Like it is a systemic mycosis, so we know that there is going to be the mode of infection is going to be the inhalation of the spores. Here the spores are going to be arthrospores, which are very infective, right? It is one of the type of asexual spores like we talked about. So inhalation of arthrospores is going to happen, and then these arthrospores are going to reach lung. Okay, they are going to reach our lungs, and here in the lung they are going to change into a spherule. Now, what is a spherule actually? A spherule is a sac-like structure, right? It is a sac-like structure. So what happens is after the arthrospores reach our lungs, they enlarge, they become rounded, and there is internal septations to form the sac-like structure, which is about 80 to 120 microns in size, right? And this spherule, let's say this is the spherule, and it contains these uninucleate endospores, right? So a lot of endospores is going to be present inside it, and these endospores are going to measure about 2 to 4 microns in size. So these are the endospores, and this is our spherule. And this spherule can rupture and release these endospores, and these endospores can again transform into a new spherule, right? So here you can see in this picture, this is a spherule, and these tiny small things are the endospores, right? So this is the endosporulating spherules, and this is how they spread throughout our body. Now the epidemiology, we can see that this is endemic in parts of California, like the name, and Arizona and Utah. And I've put up this picture of friends here in this episode. They have to map out all the states, right? So Joey, by his funny nature, just says like, you can't make up a state like Utah, which is actually a state. He didn't know that. Anyways, now the clinical features that we are going to see when the patient comes, right? So as we all know, again, these people are going to be asymptomatic. Our immune system is going to take care of it. But if the symptoms at all appears, we have pulmonary manifestations, right? We have pulmonary manifestations, which are the most common one, and they can cause pneumonia and pleural effusion, right? And there are skin lesions as well. Skin lesions can be present, like erythema nodosum, and some kind of rashes as well, right? So you are going to see pulmonary manifestations like pneumonia, pleural effusion, and skin lesions like erythema nodosum, and you are also going to see arthritis in some cases. And in cases of disseminated coccidioidomycosis, right, in HIV infected people, there can be involvement of meninges, right? There can be involvement of meninges, skin, and bone. Now, how are you going to diagnose it? So for the lab diagnosis, you are going to take up the biopsy, and you are going to stain it with some Romanowski stain like GMSA. So again, after staining, you are going to see on the histopathological examination the spherules, right? Like we already just talked about. So this is the spherule, and these are the endospores, right? So these are the endospores, and this is the spherule. Now we can do culture. Of course, we can do culture on SDA, and at the 25 degrees Celsius we are going to see at 25 degrees Celsius, we are going to see the hyphal form. And these hyphal forms are again special. These are fragmented hyphae. And why am I calling them fragmented? Because they have these barrel-shaped arthrospores, which are the infected forms, and they contain these in between these cells, which are known as empty cells. So these are the empty cells, and these are the arthrospores or arthroconidia, whatever you want to call them, right? Arthrospores or arthroconidia, right? So this is how the hyphae is going to look like, and as I have already described that at 37 degrees Celsius, they are not going to show the yeast form. They are going to show those that, you know, the very form we talked about, the endosporulating spherule. And when that ruptures, that spherule ruptures, those endospores can go and form another spherule, you know, new spherule. Now for the serology, we can do antibody detection, right? We can do antibody detection by immunodiffusion test, right? We can do antibody detection by immunodiffusion test or CFT. Now how are you going to treat it? Again, there is for the treatment we use itraconazole and amphotericin B. Okay, we are going to treat them with amphotericin B. This is both for the cases of disseminated cases. Okay, and in case the patient has meningitis due to this coccidioidomycosis, right? So we use fluconazole in case of meningitis. So let's take a small recap of what we have just learned, right? So Coccidiodomycosis is another type of systemic mycosis, right? It is also known as desert rheumatism, valley fever, or California fever, right? Caused by Coccidioidomycosis fungus. Now, for the pathogenesis, it is somewhat same, right? There is inhalation of the arthrospores, which reach the lung, and they change into the spherule, which is going to measure about 80 to 120 microns in size, and it is a sac-like structure, which is containing endospores, which are about 2 to 4 microns in size, right? And these spherules can rupture and the spores are released and they can form again new spherules. Now for the epidemiology, it is found in some part of California, Arizona, and Utah. And in the clinical features, they are normally asymptomatic, but if at all symptoms appear, the pulmonary manifestations, which are the most common ones, are pneumonia and pleural effusion, and skin lesions such as erythema nodosum, and some rashes can appear. And in disseminated cases, the meninges, skin, and bone involvement is also seen. Right, now for the lab diagnosis, we are going to do the biopsy and do the histopathological examination. And in the histopathological examination, we are going to see the spherules, right? The endosporulating spherules that we talked about. Now what else we can do? We can do culture, and at culture, by doing culture at 25 degrees Celsius, we are going to see the fragmented hyphae, right? Why we are calling them fragmented? Because we are going to see arthrospores. These are, by the way, barrel shaped, right? These are barrel shaped arthrospores, and in between them are the empty cells, right? The empty cells are present. And at 37 degrees Celsius, we are again going to see endosporulating spherules. By serology, we can do antibody detection through immunodiffusion test and CFT. And for the treatment, we are going to give itraconazole and amphotericin B in case of disseminated cases. And if the patient has meningitis, we can give fluconazole, right? So I really hope you guys like this video. Thank you.